Recording has started.
Can you still hear me?
Yes.
Okay. And so the major categories of expenditures include personal protective equipment, response and planning efforts, behavioral health and substance use treatment services, broadband deployment, tourism businesses, nonprofit assistance programs, and businesses, in particular small businesses with fewer than 100 employees and other businesses who may have experienced COVID-19 related expenditures. So we've had a very good response from many different municipalities, from health and medical organizations, some educational institutions, including school districts, CPI, our business and economic development community, including CBICC, the Ben Franklin Partnership, Phillipsburg, Downtown Bellefonte, and Penn State's SBDC program. We've also worked extensively in preparation. We knew that this grant was coming. We didn't really know the parameters around it, but we have on the phone today in the meeting our Human Services Administrator to give us some ideas around areas where we might be able to augment and assist with behavioral health and substance treatment services. So we do have quite a robust response at this point. And, not sure if you want me to go into any of those or if that's enough of an overview.
That's fine, Margaret. Yeah, I think that's a good overview of that. Would you want to talk about some of the DCD, some of the things we've learned recently about the from DCD, some of the guidelines there?
Sure. So since the initial information was distributed, we have learned from DCED through our County Commissioners Association of Pennsylvania first that the actual application is due on Wednesday, not Tuesday night. So that gives us just a little bit of flexibility. That's one good thing. We do have some questions into them around what types of organizations might be eligible, including authorities and government-related entities, but perhaps not specifically municipalities. We are asking some questions about specific use of the funds because the buckets or the categories, the let's see, 1, 2, 3, 4, 5, 6, 7 that I identified are somewhat broad, and we need some additional clarification about what some of those expenditures might look like, but there's more to come on that. So that's pretty much where we are. We did speak with DCED on Friday, and I know that they're working to get this information back to us. We also learned that our proposal submitted on Wednesday does not need to be inclusive of dollar amounts, nor does it need to be inclusive of what organizations might provide or be reimbursed for COVID-19 related expenses. We need to provide them a plan that indicates what the county commissioners plan to reimburse, how to allocate funding across these broad categories of allowable expenditures. So what we know for our Wednesday submission is that it can be very broad. Right after that, we're going to need to drill down a little bit more and put some money attached to the different categories. But for the purposes of discussion today and our submission on Wednesday, we can be very broad and just discuss what types of projects or what types of reimbursements would fall under the different allowable expenditure categories. So some further clarification from DCED that is helpful to us, and more to come.
Thank you very much, Margaret. Just to add my brief 2 cents on this, we're obviously excited to hear from the participants from the public who joined the call, who are interested in offering their ideas about how we can utilize the $14.7 million to invest in our community. The one thing I wanted to call out was it is very unlikely that this is going to be, or that this is the only pot of money we're going to get from the state or federal government. All indications point to this $14.7 million being probably the only expenditure or again, grant that we're going to be receiving directly from them to combat COVID-19. We have received smaller amounts through the CDBG program, also through our criminal justice system. PCCD has notified us of a potential grant, and also for our elections office. But again, this $15 million represents the largest amount by far that we've been allocated for this. Second thing as well is the more that we can do as a community using the knowledge we have from the health experts and from individuals who are very knowledgeable about how the virus spreads and how it's transmitted, is the more that we can do to reduce the spread here in the community, the more that will mean to help our municipalities, our businesses, and our nonprofits. So I think that a lot of the conversation that we're looking to have is to have around how can we make sure that we are reducing as much as possible the spread of COVID-19 so we can stay in the green, so that we can keep our businesses open for as long as possible and support them for as long as possible. And again, also our nonprofits in our government sector as well. So I just wanted to offer those comments as being that we are wanting to make sure that we're being as diligent with these funds as possible, and then also making sure that we're investing them in places that are going to make sure that we're keeping people healthy and safe. So I'll turn it over at this time to Vice Chair Commissioner Mark Higgins if he'd have any comments. We can then have Commissioner Dersham weigh in as well, and then we're going to be interested in hearing public comment at that time. So, Commissioner Higgins, the floor is yours.
Thanks, Mike. You did cover quite a bit of it. I'm also concerned about some of our communities that have seen some recent improvements over the last couple of years. I know Millheim has been making a lot of progress. We've been seeing a lot of positive things happening in Bellefonte. We've even been seeing some new shoots and new sprouts up in Phillipsburg. We want to keep those areas continuing to have positive news and supporting their local businesses. Obviously, State College, especially the downtown, has the closest and most numerous exposure to visitors and the students, now that we know the students will be returning in August. So I think we should be very mindful of assisting that interface between State College, Ferguson, Patton, college townships, et cetera, with mitigating the effects of the virus, both for infection and health and for our local businesses. With the upper limit on the small business grant being 100 employees, 100 employees in this county almost gets you into the top 25 employers by number of employees. I did a number of local business groups, especially including the SBDC, have been very helpful. And I just minutes before the meeting received updated numbers. Personally, I had thought we might have had maybe 2,000 businesses in Center County below 100 employees. It turns out, at least according to one database, it's actually 4,869. And I'm sure a number of them have been affected one way or another by COVID-19. Now, as I think might have been mentioned in an earlier release, it appears that businesses that have received the PPP loan/grant or the EIDSL loan-grant are unfortunately not available for a small business grant from this particular pot of money. So I would like us to, of course, look at human services, look at medical providers, look to the university, but I would also suggest that we do put a lot of effort into helping our local small businesses because they do employ a large fraction of our non-university employees here in the county, and along with the nonprofits, they're a very, very key part of our quality of life and sense of place here in Center County. Thanks.
Commissioner Dersham, the floor is yours.
Yes. I think you've covered a lot of the bases, but I'd like to spotlight a few that I think are very important. I think general business relief. I agree with Mark, particularly on that. I think we have a lot of impacts that we can probably help mitigate. Health and medical, along with the human services. And I would include CPI in there under the educational part of it. The not-for-profits are incredibly important. I think they are being probably hit by this as hard as any. I think we need to look at the broadband conversation. General PPE for anybody and everybody who needs it. I think that should not be an inhibitor for anyone in the community to make sure that they have enough of that. And I really do believe that we need to look at how we can help Penn State be successful in their endeavors as they attempt to open this fall, and whether that includes PPE for them or opportunities to provide, whether it's thermal imaging screening or whatever it might be for Penn State. I think we need to provide them with the tools to be successful. And I also think that Penn State students as well probably have been impacted as well. So how we can help all those sectors is pretty much where I'm starting. Those are my main areas, what I would consider important at this point. And the broadband conversation, I don't know if it's something that we need to look at from a kind of pay in advance, because it's going to be pretty tough to get infrastructure up in the air by the timeline that this grant is indicated. But I do believe we can contract with broadband providers and find particularly internet for some of the outlying areas that as the school districts go back into force, that they have the capability of doing remote learning as well. So I think we need to do everything we can to provide the tools to the community. And but I think with $14+ million, we can make a pretty good dent in it. So that's where I'm at.
Thank you, Commissioner Dersham. Just to echo the comments that were made by our administrator, Margaret Gray, we were pleased to hear that DCD is not requiring us at this point during the submission of the application on Wednesday to identify each and every category in the amount that we're going to be spending in it. Rather, we're just going to need to list all of the things that we're looking to spend on. And then as we go throughout the month of June and then into July, prior to us actually getting the funds by the 15th of July, we'll be able to work through over the next month, identifying each category and the amounts that we want to put in. So really what we're interested in hearing from our team at county government and then also members of the public is the ideas that you have and the thoughts you have in terms of what other communities are spending resources on, maybe an article you've read, a study you've read into how we can make sure that we are navigating COVID-19 as best possible way as a community. So we want to hear all these ideas because our view is that we can put it into the application for DCED, and then as we go throughout the next several weeks, we can start to identify the funding amounts. So again, 15 million, 14.7 million sounds like a lot. It's a very finite resource. Again, it probably is going to be the only one we're going to have as a community, but we're going to make sure that we are doing as much as possible that we can with those funds. And we also anticipate that DCD will probably be giving us a little bit more nitty-gritty guidelines as we get access to the money. We want to make sure that we're giving a true sense of what it's going to mean to accept this money and what are the requirements that go along with this. We do know some audit requirements are going to be needed. We know the money needs to be expended by the end of this year. So as we learn more and more about that, we'll be getting that out to the community. So Margaret indicated we do have some members of the team on the phone, so I'll turn it back to her, and she can turn the floor over to them as we see fit. Margaret.
Okay, thank you very much, Commissioner Pipe. Just one additional comment I would make, and probably I should have said this at the top, but one of the things that we have to remember in this is that these funds are not earmarked to be used to replace revenue. So they really are to be focused on COVID-19 related expenditures that have taken place or that are prospectively possible, but they're not to replace revenue that a business may have lost. So the funding would include expenses related to something that had to stop, so that if there was an event and advertising was used and expended and other items in preparation, but then the event or the uh, whatever had to stop, that would be allowable. But I just wanted to put that out there because I do know that in some of the proposals we've seen, there is a request for replacement of revenue, and I don't think that that's within the scope of this particular grant. We are going to verify that again with DCED, but I think that's outside of the scope of what is allowable. So just wanted to add that. On the phone with us, we have Natalie Corman, our Human Services Administrator, and I'm going to let her talk a little bit about what she's seeing in terms of how we might be able to assist with behavioral health and substance use treatment services, as well as some other needs that are and expenditures that have already taken place in the community around homelessness and COVID-19. I'll turn it over to Natalie.
Good afternoon. In terms of the behavioral health and substance abuse services, what we really want to look at is the funding that we receive from the state to provide those services through the county that we then contract out for. That funding is meant to support individuals that do not have insurance, are either underinsured, or do not have the economic means to have their services that they are able to do. So we fill that void between individuals with private insurance and medical assistance for those that are without in our community. So what we are going to be looking to do is reaching out to the people that we've already, that called our services throughout this time period, and then moving forward, is that if we are engaging with an individual for whether it be substance abuse or mental health treatment or whatever the case might be, and their loss of revenue and their loss of insurance was due to COVID-19 and loss of their job, we could see about offsetting the expenses for their services using this funding versus the state funding that we are typically allocated. So we're looking to make sure that, if there are individuals that have lost their healthcare insurance, that have lost income, that we, no matter what, could provide services to them, but with this additional funding, we would want to make sure that we are allocating all of our expenses as well as we can to support individuals. So we're really looking at that, really making sure that we have opportunities to get our services out there, to promote the services that we offer through our contracted providers, and then ultimately support our providers who are able to do these services as well. I know also of particular interest through behavioral health is suicide prevention and suicide awareness. So I think we would look at some additional opportunities to make sure that individuals are fully aware of not only our local crisis services, but the statewide crisis services that the state implemented due to the COVID-19. They created a warm line, as we call it, that actually our local provider is a part of, but we would really want to make sure that the community is fully aware of it. And so this funding would provide opportunities for us to link some additional resources to potential either employers or medical facilities that maybe we've not encountered before, but due to COVID, we would want to have that connection linked up to make people aware of any suicide prevention opportunities, to make sure that we are meeting people's needs. And so the same for substance abuse disorders as well. We have been tracking every week since the beginning of March what our needs have been from a county perspective, the people that are calling in and asking for whether it's outpatient treatment or detox or rehab. We've been tracking all of that. So again, it would be looking at opportunities to support individuals who have a need for treatment, who have been affected by the COVID-19 pandemic. In terms of nonprofits, we are looking at it I looked at it through a human services lens. Obviously, we have a lot of nonprofits in our community. Not only are they supportive of our community, they are also employers. But we really looked at it from a human services kind of lens. And so we've been looking at, the groups that have done increase in food security, groups that have done the increase to address homeless needs. We've looked at groups that have had to address the increased medical needs of individuals, groups that have had to completely kind of restructure their services to meet people's needs in the community rather than in a home setting or in a community setting. So we really want to and continue to look at those individual nonprofit agencies that have kind of had that impact to meet people's most basic needs and support them. So obviously, some of our home delivered meals. We look at our homeless providers, also the medical providers that are nonprofit entities. And then just other ideas is, we move forward and we offer our services back to the community. There's going to be a lot of safety precautions, as the commissioners previously put, about keeping our community safe. So how do we support those nonprofits that provide services to do that in a community setting, but also keeping our community healthy? So expenses related to that factor is also what we are looking at as well to support those nonprofit agencies in our community. That's kind of what I had in regard specifically to this.
Okay. Thank you. Mr. Pipe, did you want to say anything, or would you like me to continue?
Sure, please continue. Yes.
Okay, I would just add on to what Natalie said from the rest of the county's perspective about personal protective equipment. I don't think that Jeff Warren is on the call today, but as I read through the proposals, not only from our own county departments and from all of the other organizations that provided us with requests and proposals so quickly, for which we are very grateful on the turnaround time. They're very thoughtful and helpful. The common denominator that really cuts across almost every single one of them is the need for personal protective equipment, for going forward equipment and supplies for physical alterations so that we can make workspaces and business places and educational spaces safe. And I think that those two areas seem to just cut right across almost every single proposal. And there are significant amounts of money that have been spent already. And there are some really great creative ideas for how to move forward to make the community at large safer, not only in our individual workplaces, schools, but community at large. And I think that you're going to see that as we go through these individual proposals. But that's a very big area for county government. I don't think that any other county, I don't know, Chad, you're on the phone today. Would you want to speak to technology? Because I think technology has been important for us, the expansion of technology, the ability to work and communicate remotely. And I'm seeing that in a lot of other proposals from some of the educational organizations as well. But maybe you could speak to the types of things we've spent already and what we would look to in the future.
Yes, I can, Margaret. So in order for us to be able to have many of our workers have remote access and work from home and get out of the building to help social distance, we had to increase our number of Citrix remote access licenses by about 100 licenses. And in order for our infrastructure to support that, we had to sorry about that. We had to purchase additional hardware and equipment for our infrastructure to be able to support those licenses as well. We also had to get video conferencing licenses. We've done that through Zoom and BlueJeans.
Thank you. And I think that a lot of the other government organizations and businesses have done the same. We know our schools have certainly done that as they've had to move on a dime to remote learning. So I think technology as part of that big umbrella of response and planning efforts really does seem to cut across almost every proposal as well. Mike, that's it as far as our internal county presentations for today. Turn it back to you.
Okay, thank you very much, Margaret. So what we're going to do is BlueJeans has doesn't have a real robust way for people to say they want to speak, or Zoom has some other options like that, but we prefer Blue Jeans here at the county. But if you would be, so we're going to do this in the most orderly way that we can possible. Please feel free to send a chat message if you'd like to make a comment or have a question that you'd like to ask. But what we'll do is we're going to, if anybody has, if somebody would like to unmute, you can do that as well. You can simply just unmute yourself to ask a question, but you can also do it in a chat, the chat message box if you see it there. So we have Joanne Tosti-Vasey from Bellefonte Borough would like to make a comment. So we will turn the floor over to you, Joanne.
Thank you, Mike. The question that I have is, will funds out of this program be available for municipalities? And if so, what kind of things do you think we should be looking at? And then once of that, then I'll have some ideas.
Thanks for the question, Joanne. So yes, so one of the things that is allowable, and what we're going to do is in the chat box message for everybody who's on the call right now, we're actually going to drop in there a link to the guidelines. So if you have any questions about the guidelines, we have a link there that DCD put out there for us. But the guidelines stipulate that there are certain categories where the funds can be spent, and actually specifically called out are for its assistance to counties, municipalities for response and planning efforts, including the purchase of PPE. So, for example, Joanne, Bellefonte Borough would be able to use this for response and planning efforts, including purchase of PPE. So that's all that we know at this point. Again, I think the way that we're proceeding forward with the application would be to say that we would be allocating a portion of our 14.7 to municipalities for response and planning efforts for COVID-19. But then as we await further guidance from DCED, that we would be able to fill you in terms of what their specific guidelines would be. But I would hope as well that for the Borough Association of Pennsylvania, League of Cities, and also the Pennsylvania State Association of Township Supervisors, they'd also be working with DCED to get a better idea of how municipalities could spend this money. But yes, to answer your question directly, municipalities can receive this money. We are having conversations about that, and that we would be also looking to get further guidance on how this can be used.
Okay. So some of the ideas that I had would be particularly helpful for municipalities is lots of us have parks and we're concerned about sanitizing. So like being able to purchase hand sanitizing stations that we can place throughout our communities would be very, very helpful. Money for service, and Natalie, I think, sort of referred to this as for like CVIM's Center of Volunteers in Medicine to provide funding for people who are uninsured or underinsured for any medical services that they might receive. You mentioned authorities, and I don't know if this would be going through an authority or doing it through individual application, but individuals who have lost their jobs or have had a major reduction in their salaries that are having problems paying their utility bills, whether that's electricity or water or sewage, if there could be some kind of reimbursement program for them, that would be very, very helpful. So we try to help them, keep them as whole as possible. There was one other one. Let me think of it. The idea of PPEs. Oh, and you said somewhere, I think it was physical space improvement, that it would be helpful for not only businesses, but for nonprofits and for municipalities that are having to revamp their facilities in order to help with the social distancing. For example, Bellefonte has just revamped their upstairs hallway going into the building so we can have a waiting room area, and that's cost us some funds. It would be helpful if we could have some reimbursement to that, and it was basically done for safety purposes for COVID. So those sorts of things, I think everybody would be quite helpful.
Thank you, Joanne. I think, and one of the things that we're going to do is we're going to be basically, again, requesting through the application process, erring on the side of caution and putting in more requests. And if DCD has indicated through, as Margaret said before, through CCAP that they would work with us to amend the application as we go from here. So we'd rather err on that side of caution. But one of the things that Margaret and our team are going to do is going to be compiling a list of the questions that we're hearing today, questions that we've received via email, social media, and the phone calls as well, asking questions about how this money can be spent. So we're going to be compiling that, getting that to DCED, and then also making the answers we receive from DCED available to the public so everybody knows, again, the scope and specific things that we can work on. So I'll turn the floor over to Commissioner Hagan.
One more quick final question, and this is dealing
Sure.
with the deadline.
Sure.
Elton Borough has a council meeting this evening, and we could brainstorm during that of what kind of funds we could consider. If we get that into you by tomorrow, would that help you in planning your application? Those additional ideas for people who aren't on this today?
Yes, let me turn that to Margaret, and she can speak a little bit to the time frame. Again, we did have some people join the call recently, and so just a refresh of that timeline, Margaret, might be helpful.
Yes. The application is now due to DCED on Wednesday, and they've adjusted the requirements somewhat so that the proposal is broad and will not need to include specific numbers for specific items or categories of allowable expenditures. That said, quickly after our submission, and assuming that we are successful in securing the entire 14.7 amount, we're going to need to be talking about allocations by those major buckets and across organizations. So the more you can provide to us in as timely a manner as possible, so much the better. For Wednesday, we're okay, but we're going to need to move very quickly. The money will be forwarded to the county on July the 15th. And as you know, the time frame for expenditures is any time between the beginning of March of 2020 and December 30th of 2020. And we have double checked that with DCED. What they mean by that is the expenditures must be incurred expenditures by December 30th. So in the big picture, that's not really a huge amount of time. So we'll want to be very quick in turning this money, allocating the money out so that it can be used within that time frame.
Thank you again for your question, Joanne. We'll go to Commissioner Hagan to see if he has any feedback to Joanne, and then we'll go to Commissioner Dersham. Anything to add, Commissioner Higgins?
Well, I think Joanne brought up some great ideas. Obviously, anything directly related to COVID, PPE, if you're having to do redesigns to your own facilities for safety, I mean, those sound like pretty doable reimbursements. I'm hoping that perhaps some of our more densely populated areas in the county can also consider, in terms of responding to COVID, maybe something a little bit more ambitious, streetscaping, some sort of traffic flow, safety flow, sidewalk widening type situations, because in Bellefonte, in downtown State College, in portions of College Township, Ferguson Township, Patton Township, there are areas that once the students return have always been very busy and had a lot of foot traffic. And you know what we could do to try to make those areas safer. I'm hoping DCED will consider that to be a COVID-19 response.
Commissioner Dersham, anything to add to Joanne's question?
Well, I think in general, I believe that there are a lot of areas that she referenced that are going to be very viable as far as funding. I think one of the challenges that we have, and probably something we should discuss yet today, is with the administrative allowance that this grant provides, we really need to look at some mechanism or some accounting and some, I'm trying to think of a right word, almost traffic guard here to be able to field some of the questions. I don't think our office is equipped to deal with probably the barrage of not only requests but also the technical amount of time it's going to take to go back and make sure that these are all valid expenditures under the Social Security Act. I think it's 601D, which is pretty much what all the allowable expenses fall under. Long story short, I think we really need to set up a mechanism to account for these monies, to act as kind of the go-between between county government, state government, and the folks in our community that are. There's going to be a lot of requests come in, and as time passes, there will be a lot of opportunities for that discussion. And I think we need to provide that mechanism first thing to do that conversation. So that's where I would. That's the first element that I would start as far as putting a team together for this project.
Yeah, Commissioner Dershowitz brings up a good point. I've done some research on the small business and nonprofit side. Penn State SBDC needs to double check with a couple of people at the state level, but they're willing to help out with the small business grant applications, possibly help out on some of the nonprofit applications. There's a chance we could use CEDACOG as a backup for some of that work. And then there's a chance that maybe one of the CDFIs, which is a specialized community finance group at the state level, might also offer some services. But yeah, in terms of municipalities and some of the other buckets, Steve, I think we're going to need to work with our capable staff and figure out, do we have capacities to handle some of this in-house, or maybe, to your point, we need to use some of these administrative fees to cover consultants or something like that.
Or I think we're probably going to end up having to actually physically hire somebody to work either in our finance office or in the commissioner's office to provide that level of guidance, and we're just going to be overwhelmed, I think, with between the regulations and may we spend money in these areas, as well as keeping track of the funds that we have and that have been expended. So I think that's something that we really need to consider very early in this process.
Yeah, and to go to that point, we have the guidelines give us either $200,000 or 2% of the amount that we were allocated, whichever is less. And for us, that would be $200,000 of this 14.7 can be used for administrative fees. So we would need to be aware of that. In addition, we are able to use some of the money for county response and planning. So, but essentially over that 14.7, we would need to make that $200,000 stretch quite a bit for administrative fees. And if that's going to be a combination of internal to the county, potential nonprofit fees, potential grant and business grants, we're going to have to make that stretch. But absolutely, that's going to be a topic of discussion for how do we do that. So I'm very supportive of having a conversation about staffing up or allocating time and resources for internally, but we probably would have to look at potentially creating a position. So again, we'll be able to word that conversation about the administrative fee, I think, pretty broadly. It gives us some options as we come into July before we actually start to receive the money. Also, we don't actually know how much, what the level of DCED assistance is going to be on this. If they're just going to be a phone call away, or if they're actually going to designate somebody that would be 24/7 for Center County. So that remains to be seen as well. So, but yeah, great points to both my colleagues. Okay, we did receive another chat question, and this is from Mike Bloom from College Township. The question is, has DCED given any indication if the county can transfer funds between designated funding buckets as needs evolve? And yes, they have given the County Commissioner Association of Pennsylvania guidance saying that after we submit for the grant and the application, and as we go throughout the process, that we will be able to be flexible when it comes to that. And so they have indicated that they would be willing to do that. In terms of what levels, we don't know if there's a certain cap where they say you can only transfer a certain amount of funds. That remains to be seen. But I think that's a great question Mike, that we can ask back to DCED to see if they have any initial thoughts on how much we can be flexible with. So great question. Any other, please feel free to unmute yourself, and we'll take the first person who'd like to unmute themselves and offer comment.
Hi, Mike. Go ahead.
Hi, Gary. Yeah, we'll go with Gary. Gary, hello.
Yes. First of all, I would like to offer the Chamber's services any way we can help. We're not eligible to get any of this money directly, but we're willing to partner with anybody who is, and to provide whatever assistance we can to the county. And I'm really excited about the broadband development act, because this could have ramifications out beyond the emergency and strengthen the business opportunity and climate throughout the county. So I'm really excited about that. On the planning end of it, I think one of the things we ought to look at is what we do if there is a possible second wave of COVID outbreaks. You know, what can we do better that wasn't done last time? And when COVID testing becomes better available, what's the most efficient way to handle that? And also possibly scenarios for efficient administration of the vaccine. We don't know how it's going to be made available or under what terms, free or otherwise, but we could look at some of the scenarios for that to be better prepared, and try to identify some best practice models that we can adapt then to Center County. One of the things I think that's lacking is that there's been so much information out there. There's so many sites you can go to. There's so many links that you can look at that many people, I think, are overwhelmed. So I think it'd be a great public service if we did some brief Corona education spots on radio that says this is why you wear a mask, or this is how you can better protect yourself. I think we would reach a larger audience and have a deeper penetration on ways to slow the or reverse the spread of the virus. That's basically what jumped out to me off the top of my head. When I write a grant, I always try to work in that this is our general plan, but we reserve the right to make any allowable expenses and adjust it as needed for better efficiency. And that's language I always try to get in there. So thank you very much for holding these meetings. And again, whatever we can do, we'd be happy to do.
Thank you very much, Gary. We appreciate that feedback very much. And I don't know if we had PSAs on the list, and we actually heard from some healthcare consultants that say, and we're not certainly putting the commissioners in this category by any stretch, but this might be notable Center County residents or Penn Staters that would be able to do PSAs. You think of Coach Franklin, Pat Chambers, the basketball coach, folks who are able to, or high profile individuals in the community, and their voices would really speak volumes when it comes to doing the masking, hygiene, the social distancing. So PSAs might be something that we could work in there. It's a great idea. So thanks for offering that up. Commissioner Higgins, any feedback for Gary?
I think, as usual, Gary's been very organized. He's raised some good points, and yeah, I'm sure that as we move forward with some of the business assistance, we will be working closely with our chambers and economic development groups throughout the county. Always appreciate everything you do for the Bellefonte and Inter Valley areas, Gary, plus the county as a whole.
Commissioner Dersham, any feedback?
No, I just think once again, it really is going to take a community effort to make sure we deploy this money about as effectively as we can. We have the opportunity, I think, to make a big difference here, and I think the business community is they've been impacted probably as hard as anyone, and certainly we would appreciate teaming up with them as part of this relief effort. So, thank you, Gary.
We did want to jump in with a question from Kristen Moyer from CEDACOG. She is the Community Relations Director, and she's mentioning that she has read the guidelines that DCD has put out, but she's stipulating that have they given any guidance on the compliance requirements? And we are still working with the governor's office and DCED to better understand that what that stipulation means. Essentially, the guidelines have a area where they call out the fact that in order to receive to be a recipient of these funds, that entities must stay in certain guidelines. And so we are still getting word back from them. And so one of the things that I think all the commissioners are going to agree on is before we give any money out, we're going to make sure that the entities that are receiving it, whether they be governmental, nonprofit, or for-profit, have clear guidance on how that money can be spent and some of the requirements that go along with reporting. We understand that there's going to be some forms that DCD is going to require to be filled out. Again, to go to Commissioner Dershow's point about the administration of this, we have to be very aware of what requirements are going to occur and whether that's a centralized requirement or if that's going to be asked of each of the entities that are receiving the funds. So again, we have to have those conversations. But Kristen, to go to your point, I think we're going to be mindful about what that's going to look like and take our time before we overextend ourselves. But yeah, it's really a great question. Commissioner Higgins or Dershowitz, any feedback on Kristen's note about compliance requirements?
Well, I think that's why we need a team together to make that happen. I don't think any one individual is going to be able to keep track of all the expenditures and all the requests. And again, there's going to be so many moving targets. We know the generalities, but when it comes to some of the gray areas of whether or not requests do qualify, it may require legal opinion. It may require contact with the state and federal governments to make sure we stay in compliance, which I believe is very key here. But we only have until the end of the year to make sure that we deploy this money, and I think sooner better than later. So we need to get that team formed.
Yep, sounds good. Kristen raised a good point.
Okay. All right. We would we did. I think somebody was trying to get on when Gary was. So if that person would want to jump in, we'd love to hear from them.
Well, this is Rob Schmidt. I wanted to follow up on Gary's comment. I agree on the PSA idea. So I'm not clear. Is marketing included if it's a COVID related message?
Okay. Okay. So you know what to do. Yeah. We might get something where you can write the top of the Facebook. I'll clean it.
Sorry, we had to mute somebody there. No worries. Great question, Rob. So in the guidance that DCD provided, there is a section that reads that county governments can use this to offset response, planning, and outreach efforts. So our interpretation of that would be that outreach efforts would be the kind of PSAs, the kind of things that have been worked up to encourage masking, things like that. So again, we want to be very sensitive to how we're using that money, but we could be using it for PSAs, but we'd want to make sure that we're not paying a lot of costs related to that.
Oh, okay. Well, and oftentimes if you can get the media to go along with it, especially realizing how important it is for the media to have us continue to operate in the green and have our businesses open, that generates money for them, because the media, particularly the TV stations, as much as they were being watched when we were shut down, their revenue stream outside the political advertising was pretty bad. So there could be an effort to get them to play along. But anyway, the long and short of it is we realize that messaging the college students, particularly in the downtown, when they come back, is going to be very important on both sides of College Avenue, when they're on campus, but also when they cross the street. The other issue, and I don't know whether others have seen it, whether Gary's seen it in Bellefonte, but we've certainly seen it in the first 2 weeks of Green, are visitors coming in from out of town that are certainly not taking the same kind of measures that we're seeing in Center County. When you're seeing a lot more people in a store not wearing masks. We had people came in when we turned green who were saying, "Why are you wearing masks? You guys are green." So I think educating people who are coming into the area is an important aspect of what we're doing, and that could be signage. But I like the idea of using, whether it be Bellefonte or State College or anywhere in the county, having hand sanitizing stations, having some signage, but also having some messaging. I think that's really important. But I like the idea of using people that they know, James Franklin, because they're not going to listen. If no offense to the county commissioners, no offense, but they're not going to listen to you. You don't have a whole lot of street cred with the college students. No offense. Neither do I.
No, it's know your audience, right, Rob? Yeah, and so
right.
we totally appreciate that. No, thank you for the comments. Commissioner Higgins, any feedback?
No, Rob raises some good points, and yeah, especially if we could get a major, well-known Penn State figure to agree to do a PSA or two. Sounds like maybe we could cover production costs and things like that. It might be very effective.
Commissioner Dershowitz?
Well, Rob, you bring up a really good point. If we have an influx of 40,000 Penn State students, obviously that's 30,000 or 40,000 vectors back into our community. And as we look at not only the start of classes, but also if we have some sort of whatever football program and other sports programs this fall, I think we are going to need to do education to make sure people appreciate that if they want to continue going to class, if they want to continue going to football games, that we all need to cooperate and have a mutual level of understanding that safety precautions are very important, and how we deliver that message and how often we deliver that message, I think is going to be a key factor, particularly into August when we do have that influx of student activity again. So, people have to realize, although they might think that they're bulletproof at that age, health-wise, that they are vectors for the rest of the community. And when the community is impacted, they are impacted as well. So I think that message needs to be stressed.
Absolutely. I mean, that's what I try to tell students. Do you want to have a dance marathon? Do you want to have football? Do you want to have a graduation? You put it in, you have to put it into a what's in it for me kind of context.
Well, exactly. And that's why I think it's very important for us to team with Penn State to give them the resources and support that they need to get their messaging out and to provide the safety measures that they need. They've been obviously working on this for months now, but the lifeblood of our community runs through University Park. So we've got to be smart about this, and we've got to be, we really, to your point, we need to be proactive in making sure we get that message very crystal clear out to the community, and particularly those that are coming into the community as visitors.
Absolutely.
Thank you, Rob, very much. Yeah, appreciate it. We're going to be working with you closely as we know how vital you are in the downtown. We did have a question from Sue Hannigan. And Sue, we'd be happy to turn the floor over to you if you wanted to make some other comments. But you raised a really good point about buying in bulk. Would you like to make any comments further other than that, Sue?
Well, thank you very much for the opportunity to comment. That PPE is pretty consistently needed, and I was thinking of, as Joanne was speaking about that for Bellefonte Borough, that there are lots of parks throughout the county that probably could benefit from hand sanitization stations that may not be submitting requests for such information. So if it were a way to get, it's just one small element, and you could replicate that same process with other PPE, not just the hand sanitization system. So that by buying in bulk, it might be cheaper. There might be a cost savings for everyone if we did it that way, if the county could do it that way and distribute it outward, and communities would then make a request for that type of product, whatever that product would be. And the other thing I was thinking about for language, I've worked in Center County for 25 years or so, but live in Clinton County, and the Amish community down here is seeing an uptick of cases. So I go back to our language access plan and think that maybe some of those PSAs should be published in paper form and distributed outward to public places in the Miles Township, the Penns Valley, Brush Valley areas. That's all.
That's a great question. As we think about the municipality allocations that we could give out, if we would do it potentially on a per population basis, there are going to be funds that are going to go into, of course, center region based upon population, but we're also looking at a hold harmless, I guess you could say, where we guarantee certain municipalities that have lower population than the hundreds would be insured to get a certain amount, and that would, of course, help a lot of the rural areas of the county. But in addition to targeting for specific groups, that's a great point you bring up, Sue, in terms of the Amish population and also populations that are not English speaking. So when we're doing these PSAs and we're putting messages out there, much like the census provided a similar challenge with marketing to different groups that may not be looking at traditional media sources. So it's an excellent point. I think we would absolutely want to look at that and discuss high vulnerability populations outside of a traditional, again, marketing strategy. So thank you for that. Absolutely. And again, your full comment for the PPE was talking about buying in bulk and distributing it, being a distribution point. And our EMA director, Jeff Warren, has been working a lot with the hospitals, long-term care facilities to be a recipient from PEMA and then distribute it out. But we would be talking about actually buying in bulk ourselves, which is certainly doable. And I will say the County Commissioners Association of Pennsylvania, which if you think about the $600 million that's going out to the non-urban counties that receive these funds, there's a lot that we could even do with the County Commissioners Association and buy it even in bulk through that standpoint and really maximize our purchasing power. So yeah, a lot of good conversations are occurring with that. But any comments, Commissioner Higgins, for Sue?
No, she raises some good points, and just want to thank her for her years of service to the county. We greatly appreciate it.
So this is Steve Dorsham. I think you bring up a really good point, and from a variety of standpoints, and that is we need to buy in this big bulk amount because businesses, municipalities, and the general public have the opportunity, I think, through this grant to have the PPE that they need without having to spend other money for it. And I think the more we make it the norm to provide this equipment and to provide whether it's a sanitary station or whether it's a mask or whatever we do in those regards will send the message that we are serious about making sure that we're keeping our county safe. And by keeping our county safe, hopefully we'll maintain it in the green as long as we can and hopefully mitigate a second wave if there is one.
Okay. Thank you again, Sue, for those comments. We'll look for any other comments that may be warranted here. If you'd like to unmute yourself and go ahead and offer those comments, we'd be happy to take them. Okay, we'll go back to the chat board here, and Mike Bloom from College Township says that the county will be inundated with requests. Absolutely, Mike, you're right with that. And establishing some priorities among and within the categories may be warranted and merited. It won't be easy and likely may frustrate some applicants, but the more that we can remove the subjectivity and be transparent in making the future awards, the better. You're absolutely right. I think one of the things that we're looking at doing is talking with some health experts in terms of understanding how best we could be making investments in allocating these funds so that we can be bringing some objectivity to how we're allocating them rather than just providing the grants rather than making sure that they are going to have a meaningful impact. As many people know, we do not have in Center County a health department, so we're very reliant on the Department of Health, also our healthcare providers in the area, but we do have contacts that we are able to work with in specific areas of healthcare that we can, again, ask questions to make sure that we're making investments that are investing in keeping us safe and keeping businesses open here in Center County. So very, very much appreciate your comment on that. We also have a comment here from Leslie Kistner, and she's mentioning that the Happy Valley Adventure Bureau would be willing to lead up messaging efforts outbound, both about what is required when it comes to some of the social distancing, but also that Center County is a safe destination. Both are definitely important messages for visitors, and this is appropriate to our mission at the Destination Marketing Organization for the county. And we did want to mention that we know that Fritz Smith, the CEO and president of Happy Valley Adventure Bureau, had written an op-ed in the Center Daily Times recently, had that published under his name, discussing some of the expectations for people when they're going to be traveling again and visiting again. And it looked like spring of 2021 was the majority opinion of when people would start to travel again and feel like they could do that. And so, yeah, we do want to make sure that our Tourism Bureau is not forgotten in this conversation. And we do want to say that in the guidelines, the tourism businesses of all sizes, including state and county fairs, are specifically designated in the eligible expenditures. So tourism businesses are allowable. And we know that we're having dialogue with the Happy Valley Adventure Bureau to see if they've gotten any guidance from their state association and whether or not tourism promotion agencies are able to directly receive the funds, or if it would just be for the businesses here in the community. So that'll be an absolutely important conversation to have. We also have, just going in that vein as well, we have a comment from Ed Stoddard, and he's discussing the fact that we need to allocate funds for the Center County Visitor Center and Bellefonte train station as we provide information and welcome visitors. And again, that same point, Ed, that we're trying to figure out is can the tourism promotion agency receive the funds? We're clear that tourism businesses can. We're not yet clear about whether Happy Valley can receive that directly. So we're still waiting guidance on that, but absolutely, you see many people who come in and we want to make sure they have a safe and well-informed visit while they're here in Center County. But any comments, Commissioner Higgins, on the tourism aspect of this?
Well, I do serve on the board of the Happy Valley Adventure Bureau. I know that industry is more affected than almost any other industry by the pandemic. In the guidelines, it would appear that for tourism businesses, there is no size limit in terms of the number of employees. I'm hoping, again, working with the Happy Valley Adventure Bureau, that some, especially the small business funds, can go toward our tourism organizations for PPE, for cleaning, maybe even for reaction to the pandemic itself for projects, so long as DCED will approve the expenditure of funds. Because I believe some of the lodging operations are seeing 80-90% reductions in revenue, and over any length of time, that's simply unsustainable for them.
Thank you, Mark.
Steve.
Yeah, Commissioner, go ahead.
I think it's very important that we maintain. We have a very strong tourism industry, and I think maybe behind agriculture, that's probably one of our biggest market sectors. So I really think that we need to look at every opportunity we can to rebuild not only tourism in general, but particularly Penn State related events, because that really is that's where the lodging industry resides, and that's certainly where they, what they rely on for their revenue. So I really think that we need to look at every opportunity, and hopefully we can find ways to do that, because the quicker we rebuild that, the quicker we make sure that our base is protected, if you will, the quicker we'll see the economics rebound here in Center County.
Okay, thank you. We're going to, we have another question here, or comment, I should say, from John Peterson. John says, it would be nice to keep funds to purchase goods and services in Center County or other areas within the local economy, keep the money in the Commonwealth economy. It might not be ideal for all aspects, but should be kept in mind if it is possible. So again, basically investing locally and keeping the money here locally as much as possible. So thank you, Mr. Peterson, for that comment. Any other comments? Again, feel free to unmute yourself, and we know we have partners here from our nonprofit sector, from our municipal government sector, so we would welcome any other comments if there would be any. Okay, we'll give the information out one more time in terms of how individuals can offer public comment if they'd like to on this. We have our email address, which is boc@centercountypa.gov is how we can receive our public comment through email. Our phone number is 814-355-6700. And we can also be found on social media platforms at Center County Gov, Twitter, Facebook especially. Again, our deadline to apply for the funds is going to be on Wednesday. We do have 2 more public meetings scheduled for tomorrow at 10 a.m., which coincides with our Board of Commissioners meeting. So that login will be available through Blue Jeans as well. And then also at 4 o'clock on Tuesday, we have another public meeting where we're going to be, again, focusing solely on the COVID-19 relief grant. For Wednesday, I'll open this up to Commissioner Higgins and Dersham as well, is would it make sense for us to find a time on Wednesday as well to have one final meeting? Our thinking when we announced the public meetings on Tuesday at 10 a.m. and 4 o'clock, that was thinking that the deadline to apply was going to be Tuesday, but I wouldn't be opposed to having another one on Wednesday just to wrap things up and see where we stand. Any opposition to that from either of the other commissioners?
Yeah, Wednesday doesn't work for me. I have another obligation, regrettably. So if we could wrap it up on Tuesday, tomorrow, that would be great. I don't see anything here that indicates that we can't. I think what we need to do is figure out where the allocation numbers are going to go. And as far as I'm concerned, I think we can do it tomorrow afternoon. I'd really like to wrap it up and make sure that Margaret has the opportunity to get the paperwork in place for DCD.
I have a fair bit of flexibility on Wednesday. Morning would be better for me. I do agree with Steve that we need to set some sort of reasonable cutoff for Margaret and the staff to take all of the public feedback, summarize it, put in as much into the document as makes sense, and get it off to DCED in more than enough time. So if there are any glitches, any internet problems, any boxes that didn't get checked, time for error messages to come back. I don't want us to, realistically, a couple days ago we were looking at, oh my gosh, if the deadline's 5:30, we probably have to submit this thing at 4:30 on Tuesday. Let's give staff some time on Wednesday to submit it, give time to identify or fix any problems so that we're not trying to call DCED at 4:35 on a Wednesday afternoon.
Good, great points. Margaret, in terms of the time frame, would you like to set a cutoff time on Tuesday where there is a cutoff where you and the team could get this together?
The public meeting, a work session, is tomorrow at 4 o'clock, where the Board of Commissioners will make its final determination about the types of programs and projects that you would like us to reference in the proposal. So I think at the conclusion of tomorrow's meeting should be the cutoff, because that will be the point at which you have said these are the things that we want to move forward to DCED. Again, remember, we do not have to be dividing the allocation formula right now between and among the different categories. So as long as we can be articulate about the types of programming, projects, ideas, expenditure items that have already occurred and incurred, I think we should be good. And I appreciate having that conclusion at the end of Tuesday. That gives us Wednesday to write the document in its final form and get it submitted.
Thank you, Margaret. And again, as we've learned from DCD, they're going to be as flexible as they can in terms of amending, and if a category or a line item fits into the categories, they're willing to amend our application. So we can certainly let people know who might get to us later this week or miss the deadline of Tuesday that we can still receive their comment and keep that for future consideration. So, okay, sounds good. Then we will not be meeting then on Wednesday. Rather, we will give that day for Margaret, you, and the team to finalize this. And we would then still be meeting at 10 a.m. Tuesday and 4 o'clock tomorrow. But we did have one other question here, and it would be if an entity submitted prior to now and they desire to change their request, would we require an update currently, or would the original request essentially serve as the letter of interest? And essentially it would be if somebody's already put an idea forward and they would like to amend something, that's fine. But if just the amounts would change, that really wouldn't be necessary at this point. But if there is if you know what the request is and you'd like to get it to us, we'd be happy to take it. Sooner is better than later for that. But again, we want to stress the fact that we appreciate the fact that this is such a condensed time frame. We would have loved to have had weeks to have this kind of community dialogue, to have a little bit more of a runway, but we're in a time period where we need to be nimble and quick and agile, and so we want to highlight and thank Margaret for getting this effort together to hold these meetings and also to organize all the requests. There's a lot going on right now, and so DCD asking us to do this. The fact that we would be getting $15 million is enough of a reason for us to focus on this and do this. But just want to thank Margaret for all that she's working on as well with this. We look then for any other final comments. We want to appreciate everybody's time in joining us today. But any final comments, again, you can unmute yourself and offer them. But if we hear none in the next few moments, we will look for a motion to adjourn this work session, and we would again have 10 a.m., 4 o'clock tomorrow, same link, and then we're also going to be looking at potentially, any of the comments that that come in through social media and our phones and email as well. So any other comments, feel free to unmute yourself, and we'll take your comments. Okay. We do want to note, we'll note one more comment on the chat, and then we'll look for a motion to adjourn this work session, which is Gary is just saying again, we should look at doing a bulk purchase of PPE and have that ready for the second wave until other sources become available. So thank you. We'll leave that on that note with the importance of PPE and the fact that it is an allowable expenditure under this line item. So again, everybody, thank you so much for joining us. We would look for a motion to adjourn the work session at this time.
Anybody else here? Going once, going twice? All right, I will make the motion to adjourn the Act 24 COVID assistance work session at 2:18.
I will second that.
All right, any further discussion on adjourning? Hearing none, all those in favor say aye.
Aye.
Aye. All right, we are adjourned. Thank you, everybody.